I am 45. I battled with weight loss my whole life. My heaviest weight was 505. I never thought I would ever hit that. The challenges with my weight were just everyday tasks. I had a hard time moving around. I had arthritis. I developed diabetes. My son played baseball, so I had challenges with getting out to the field and working with him. And I just decided I needed to make a change. I had a little bit of a chemical imbalance, and every time the doctors tried to give me medication to fix that, it would just lead to more weight and more weight. I worked with a dietitian for a while. I worked with a personal trainer, and the weight wouldn't come off. I was in a hopeless spot. I could say that I was, depressed quite a bit.
Chris was a perfect candidate for a robotic Roux-en-Y gastric bypass, and he's done fantastically. The robot is utilized in a lot of different areas of surgery. I use it for colorectal surgery. I also use it for hernias. I also use it for gastric bypass and bariatric surgery because it allows me to hand sew all the connections of the bowels, which really improves outcomes with still minimal incisions and a short length of stay. Using the robot is kind of like playing a video game in that you put your hands into the controls and you're looking at a screen. The robot has 4 arms. So there are 2 arms that can be used as my left and right hands. There's 1 arm for the camera, and then there's another arm that can be the assistant. When I put my head into the console, it senses that and it activates and it gives me control. I get 3D vision, which gives me depth perception. It's very high resolution. When you have a high resolution image with excellent depth perception, then you really can do very fine suturing and fine instruments. If I take my head out of the console, everything freezes and nothing is able to move for safety. I put my hands into the little controls, which I control basically with 2 fingers, and then it articulates just like my wrist. I control the camera with a foot pedal. It's like playing the drums. So here we have a very small piece of origami paper, and you can see that the robot can easily fold it symmetrically. So this exercise is meant to demonstrate the dexterity of the robot in doing fine movements. The benefit of the robot to the patient is the same as the benefit of any minimally invasive surgery to the patient in that the incisions are smaller, so there's less pain, there's less scarring, the recovery is faster, patients can go back to work more quickly.
I'm ecstatic after having the surgery. My whole entire life has changed. I bought a motorcycle. That was my present to myself for losing 200 pounds. I can walk the neighborhood without getting winded. I take the dogs for a walk. We have a goat. We walk the goat. I've chased the goat outside. When it's gotten out, my diabetes is completely gone. I lost that within 3 months. I got taken off all my diabetic medications. Just everything has gotten better in my life. I'd just like to thank Dr. St. Julian and St. Anthony's for giving me a new life.
Continuing to improve and grow the robotics program at St. Anthony's will keep this hospital at the forefront of surgical innovation and standard of care. Patients want the best care, and we want to be able to give it to them. And having a robust robotics program is at the top of that list.